Hi everyone, my name is Zulfikar M. Aslam. I'm a global inventor, a research scholar at Durham University Business School, and a senior lecturer of innovation, technology, and entrepreneurship at the United Arab Emirates University. The title of my research is AI powered rapid and innovation method for detecting type 4 hypersensitivity to metals, and that is titanium dental and surgical implants as a cause of neuropsychiatric symptoms in elderly patients. Uh, Titanium implants are widely regarded as safe, with increasing demand among surgeons. However, there is a concerning rise in mental and cognitive issues in patients post implementation. Common neurological issues or disorders are immune disorders, depression, anxiety, schizophrenia, dementia, and chronic stress. Dental and orthopedic surgeons remain largely unaware that the titanium may induce electrical brain abnormalities. So, research also confirms that the hospitals lack the capability to perform essential invasive blood tests for diagnosing type 4 hypersensitivity, such as LTT and Melissa, and that is globally. These tests are performed invasively, and the test can take time around 2 weeks. Therefore, the study aims to develop a non-invasive AI-powered, rapid and innovative method for detecting type 4 hypersensitivity from metals such as titanium within the hospital premises, and encourages dental and medical surgeons to perform type 4 hypersensitivity tests before and after applying any surgical procedure involving metals. There are various case studies. I'm going to discuss three important case studies here. Dick Van Dyke, an actor and a comedian in 2013, revealed chronic headaches and fatigue resulting in neurological issues and cognitive decline. He says his symptoms persisted for 7 years and remained undiagnosed, even through various tests. He predicted that the cause would eventually be linked to titanium dental implants through a social media and investigation from various people and groups who also had dental implants. Following the removal of his dental implants, his symptoms began to improve, and he claimed that at that time that the mystery health condition he had in April 2013 previously thought to be a neurological disorder was from his titanium dental implants, and therefore he emphasized the importance of proactive and non-invasive diagnosis system in 2013. Case study number two deals with my mother, whose name is Suraya Aslam, and in 2001 she was 85 years old. She's now around 90 years old. Had five titanium implants because she was losing teeth, and I thought the best solution is to have dental implants so that she can eat food easily. A month later, she experienced insomnia, cognitive cloudiness, and serious neurological symptoms that were first misdiagnosed as dementia, resulting in antipsychotic treatment, which aggravated her situation. Me believing she might have titanium allergy, assessments for type 5 hypersensitivity were performed, blood samples were sent to Germany, but it yielded inconclusive results because of her medications. And these medications were Zyprexa and Zoloft, from 10 mg to almost like 40 mg. Upon the removal of the dental implants, her health significantly improved, and antipsychotic medications were disconnected, and psychiatrists actually viewed her recovery as a miracle. Now, as you can see, her images on the right side, image before an implant, how good she's looking, and then implant after image after implant, where she was put through so many different procedures, useless procedures as a matter of fact, and calling it as she has sleeping issues and so many other things, but not highlighting and trying to find out that she has type 4 hypersensitivity. Then we have a case study number three, which is from Hattich and Norris. where a 64-year-old woman with multiple allergies suffered a fatal brain allergy reaction to titanium cranoplasty, which is a procedure used to repair and construct skull. So she had an implant causing severe swelling and later on death. So post-mortem test confirmed as immunological response to titanium, highlighting that rare titanium allergy can have devastating consequences, stressing the importance of hypersensitivity testing prior to implant. And then there are some scientific articles, an article by Shelley and Zeltmans. Their research investigated the potential neurotoxicity of titanium dioxide nanoparticles released from commonly used titanium implants in both human and animals, and raised concerns about long-term effects of central nervous system. And then Medhavan and Venugopal, their research looked at possible health hazards of titanium poisoning, such as inflammation, allergic reaction, and neurological issues. Titanium implants can turn out to be a huge issue in neurological disorders, in yeah, getting into mental disorders by patients and so on. So major challenges which we are looking into in this particular research is titanium implants are widely used for dental and orthopedic restoration, but majority of the patients have reported unexplained mental disorders. And these, of course, disorders may result from type 4 hypersensitivity reaction to titanium. Now, another challenge which I have seen and I have analyzed is that at present, diagnostic tests like Melissa and LTT are limited in availability in certain countries only, such as Germany, Israel, Switzerland, and Spain. There are only 4 labs to perform Melissa tests all around the world and 10 labs to perform LTT tests globally. So dentists and medical surgeons are not familiar with these tests and rarely suggest them prior to do surgical implants or surgical procedures. And as I have said before, these tests, the results can take time from sometimes 2 to 3 weeks to get the results. And if you are on heavy medications related to mental issues, then the test results, they don't come positive. Pre-existing invasive methodologies to detect type 4 hypersensitivity to titanium, and as I have also said before, they are done through blood tests, and these blood tests are LTT and Melissa, lymphocyte transformation test, which involves taking a blood sample, isolating white blood cells, and exposing T cells to suspected allergens into vitro, which is lab tube or lab dish. And if the patient is hypersensitive, these T cells proliferate and the response is quantified as SI stimulation index, with SI greater than or equal to 2 and 3 considered as positive. And then we have Melissa test, memory lymphocyte immunostimulation assay, is an advanced form of LTT, and a sample, of course, small sample of blood is taken, and the white blood cells, T cells, are mixed with metal in a lab dish. If the immune system is sensitive, these cells will react strongly and multiply, showing that the person has type 4 hypersensitivity, which is delay allergy to the metal. Melissa offers a more precise and reliable assessment to find out if someone is allergic to metals such as titanium, nickel, or mercury. So these are the two pre-existing invasive tests or methodologies for type 4 hypersensitivity. So what we are suggesting here is, or what we are coming up with is a non-invasive AI-powered rapid and innovative method for detecting type 4 hypersensitivity to titanium. To predict type 4 hypersensitivity, we can correlate AI-driven test outcomes with conventional LTT and Melissa test. Data can be collected from patients using variable brainwave sensors to monitor sociological features and immunosensors that can analyze fluids such as saliva, urine, sweat, and etc. These AI-driven measurements will then be calibrated against the validated values of the type 4 hypersensitivity scale or stimulation index SI obtained from global standard tests, which are LTT and Melissa. Therefore, this AI-powered multimodal can be trained to perform all the above through cutting-edge and quantum computing algorithms. Now, the detail regarding the technological structure and specifications of the system, I have not disclosed them, as this novel system and method will be filed for global patent very soon. Conclusion: this form of AI-driven research can facilitate the early identification of titanium-triggered hypersensitivity associated with neuropsychiatric symptoms, can minimize dependence on invasive and time-consuming techniques, enhance patient safety and clinical decision-making, has extensive potential in precision medicine for surveillance of treatment or implant-related complications, and it can also act as a standard for AI-based diagnostics in medical practice. That is all from my side. I'm done. If you have any questions, please be open to ask me, or through the CG Scholar communication system. You can also convey and send questions to me, and I'll respond to you as soon as possible. Thank you very much.